If you look into a large crowd, only 1 out of 1,000 people have scleroderma. I am that one person in this crowd.
On March 20th, 2018, the Steffens Scleroderma Foundation brought together over 150 healthcare professional candidates from 5 disciplines to learn about scleroderma and to learn about effective ways to interface with patients and to enhance team-building skills for the benefit of the patients. Included were candidates in nursing, nutrition, occupational therapy, pharmacology, and psychology. The candidates were led in discussion by a panel of instructors and practitioners in each discipline. Before the program, several candidates were asked about their prior knowledge of scleroderma.
I was a little aware. I was given the opportunity to participate in a workshop that was held in the Albany Pharmacy College, but before that workshop, I didn't know anything about scleroderma.
I've only heard about it once before because I had a previous workshop, but before that I'd never even heard about it, and then, which is kind of sad, being in the health field, we want to know more about it to be able to do more moving forward.
No, but I've heard of it before, but I really didn't know very much about it until this event, and then after reading some of the articles and watching the video that we had to watch for this event. But other than that, I really didn't have much background information about scleroderma at all.
So I was definitely aware of the condition and everything. I really didn't know much about it. Honestly, we got sent like a background video, which basically gave me a lot of the knowledge. We just touched about it in pharmacy school during one of our semesters, but not really into much depth at all.
I honestly was not aware of the scleroderma disease at all before this, so I'm really glad to be a part of this because this is very educational for me.
I actually was not. This is a big educational experience for me.
Let's begin. I'd like to welcome you to our first interprofessional education event on the theme of scleroderma. We're very happy to have you here. My name is Barbara Thompson. I'm a professor in the Department of Occupational Therapy here at the Sage Colleges. Basically, we're going to hear a keynote speaker in a few moments. Then you are going to work together with your fellow students to come up with an initial interview, as if you were interviewing an individual who has a diagnosis of scleroderma for the first time.
Scleroderma can affect the skin, muscles, joints, blood vessels, and major organs like the heart, lungs, esophagus, and kidneys. Scleroderma causes your skin to become hard, thick, and tight. It can also harden, thicken, and tighten your major organs inside your body, which can lead to a slew of difficult, complicated, and dangerous medical problems and even death. Over the years, I would need over a dozen specialty physicians to treat all of my medical issues brought on by scleroderma. And going from doctor's office to doctor's office 3 to 4 times weekly was very taxing on me. I also had to cart with me all of my medical records, any new tests, reports, blood works, films, anything new that I had done that were ordered by my other doctors, because having a dozen doctors communicate regularly and be on the same page was not an easy feat when you're traveling from different location to different location. I began to see my health taking a backseat to all of the miscommunications and mishaps that were taking place due to all of my doctors not being a team, not working together, not being on the same page, and not willing to put their differences aside to treat their patients. Personally, I have had treatment from individual doctors at individual hospitals, but I've also had treatment from doctors that work together as a unified team. And I 1000% feel that the team effort is much more effective, efficient, and beneficial to the patient. Since finding my medical team in Pittsburgh, I have had 0 issues. Everyone is there to look at the bigger picture, which is finding the best possible treatment plan for my body and to keep me as healthy as possible for as long as possible. Looking here at all of you tonight, I am eager to see what new and exciting things this group of intelligent, educated, professional men and women can put into action. I hope all of you can see that working together as one unified team can allow for amazing breakthroughs in patient care and medical advances. Each and every one of you sitting here tonight plays a vital role in the care and treatment of patients with this disease, or with any disease for that matter. By working as one, I know the best is yet to come for the education and medical advances in the treatment and eventually the cure for this rare and detrimental disease that we know to be scleroderma. Thank you.
At each table were candidates from all 5 disciplines. After some suggestions from the panel, each group conferred to create appropriate interview questions for the patient.
With those open-ended questions, hear them, listen attentively, follow up on what they've told you. Patients will offer you clinical cues if you are listening to their story, so really ask those appropriate follow-up questions. Make sure that you show interest in your patient as a person. Find out how these symptoms are impacting their life. Then make sure that you are working in a shared decision-making manner. Get your patient's buy-in. Elicit their perspective. Find out if their willingness and ability to accomplish the follow-up plan that you're presenting to them.
Like how did your family respond to your diagnosis?
Yeah.
Or like, do you feel supported?
Like what she was saying, what areas of your life are affected?
Routines.
You can say,
how does your husband help out?
Yeah. You can say, how has this impacted your independence?
Yeah. Or if she has support at home.
What areas of support, what areas do you need
identify
support?
areas of support like that. I mean, I guess if her children live close.
Okay, so we have every day. What do we have so far?
We have asking them about themselves, how it affects their everyday activities. If they have difficulty managing day-to-day tasks, their leisure activities, if they have a support system, if they're receiving therapy, and then if they have any dietary difficulties or restrictions right now.
What about like talking about overall quality of life, like type questions?
Could ask about her outlook too, like how she's personally feeling. If she's feeling depressed or she's feeling motivated, and I don't know.
Yeah, like what motivates you, and what's that question?
Afterwards, the panel offered feedback and additional suggestions.
And the second largest group, sadly, is bad stories travel, is that they know of it because a relative or a friend or a relative of a friend died of it. And that may not come out right at the start, but the diagnosis often is attached with an enormous amount of anxiety and fear in addition to whatever symptoms they have.
If you're not willing to be uncomfortable and realize that you need to learn something more, or you could have addressed something better, or that you let somebody try something that maybe you should have thought out more thoroughly, if you're not willing to be uncomfortable with that, then you probably should reconsider whether you want to be a healthcare professional, because once you stop being willing to be uncomfortable and grow as a result of the feedback you get and the people that you meet and the mistakes that they make and the mistakes that you make, you're no longer growing. You should probably seek a different job that deals with inanimate objects, perhaps, but you should rethink it.
I really don't have much to add because I was lucky enough to have my own 2 minutes, but just sitting here with the group, a couple of things that I think the clinicians are really sharing with you here is to have some curiosity. Be curious about your patient. Have a two-way conversation. Don't have expectations of what the answer to the question is going to be, and have your next question in mind without just listening and really opening yourself up to that two-way conversation.
Yeah. There was a burn patient that was doing very poorly, and she looked me in the eye and she said, when a patient of yours starts to do poorly, you will find yourself wanting to retreat from that person because you interpret that person doing poorly as your personal failure. And if you feel yourself starting to retreat from someone, you check yourself, because that's when they need you the most.
Each table was joined by a scleroderma patient for direct interviews and interaction. Candidates from each discipline interviewed Amy, critiqued by the panel.
I'm wondering what keeps you going? What builds resilience, for you?
For me, I think the thing that keeps me going is obviously my support system, which is my family. My dad's back there. Say hi to my dad.
Hi, Dad.
I embarrass him all the time when I do this.
So you've listed some specific things you've adapted. Is there anything that maybe you've kind of come to a wall that you still feel needs to be adapted that OT maybe can assist you with that you haven't been able to figure out on your own?
Oh, that's a good one.
What's difficult?
Excellent questions.
Life in general is pretty difficult with scleroderma, I'm not going to lie. There's a lot of things that you can't do. We have a really big step coming from the outside of our house to the inside that we haven't really been able to master yet. Well, mostly because I don't want like a ramp.
Hi, Amy. I'm Jamie. I'm a nutritionist, or almost.
Okay.
I guess I just wanted to ask you a little bit about what your day is like from a meal perspective. What do you like to eat? What are your favorite social activities that revolve around food?
I'm kind of limited to what I can and can't eat because I have a lot of throat issues with the scleroderma and swallowing, and I have a lot of reflux issues. So, but I'm not going to give up. Like, soda is one of my vices. I love it. I'm not going to give it up. I don't care. It's my comfort. I've always been like a comfort eater, so food is my comfort. And to be limited to no caffeine, not a lot of fried food. You can't have steak because it's hard to cut up. There's a lot of restrictions, not a lot of spicy food, not a lot of citrus food. So if I find something I really like, I kind of eat that until I get sick of it.
Definitely. Do you feel that your pharmacist really understands your condition, that they're understanding that you're not taking these pain medications for a reason that's something that might not be indicated, but that you really need them for your condition and everything? Do you feel you have a good relationship with your pharmacist?
Yeah. I'm on a first name basis with my pharmacist. He's really great. And they get it. And he has a couple other scleroderma patients in the area that he does medicine for as well. And I'm not on that much pain medicine, so I think they get it, that I'm not abusing it or anything like that.
Hi, I'm Olivia.
Hello, Olivia.
I'm a nursing student.
Okay.
So I guess going off the medications.
Okay.
I would not want to know what medications you're on, including over-the-counter medications or herbal remedies.
It's a long list. I'll just give you a few. Okay. We'll be here all night. I'm not really on any over-the-counter or herbal remedies. I take ranitidine for my reflux in my stomach. I take, for pulmonary fibrosis, I take a Traclear and a Ravax.
Seeing as you're such an advocate, what is the advice that you would give to someone newly diagnosed who is afraid, who is wondering why me, who is in a state of starting to research, and we talked a lot about researching, and it's scary what you find on Google about any disorder that you have. So what is advice that you would give to someone newly diagnosed?
I think the advice I would give is it's okay to be mad, to be upset, to be angry, to kind of not be okay. It's okay to not be okay with it. You're allowed to feel all the kinds of emotions that you want to feel. It's your body, it's your life, and you're allowed to go through it. You're allowed to have days where you don't want to get dressed and you want to stay in your pajamas all day. That's fine, but it's what you choose to do with the next day and the day after that kind of really makes for you as a person.
After the program, the candidates initially interviewed returned for follow-up and reaction to all they observed and absorbed.
The most significant thing that I learned during this event is the importance of a multidisciplinary team with a multi-modal approach and the communication between all the different disciplines. Really sitting in a group with, OT, pharmacy, nutrition, which is myself, nursing, psych, it just really brings so much to the table, more than...
I think the most significant things was learning how to adapt to the patient's needs. Our patient that sat at our table actually just was diagnosed with scleroderma today at 2:30. So all of our questions kind of went out the window, and we really had to just go with like what she really needed at that moment, and that was the most significant. And then I think also learning how to adapt our questions and change them so that they really went with all of our different disciplines, so that they pertain to everything that we wanted to talk about, was also probably very significant and helpful.
Definitely the most significant thing that I learned so far was just really to get familiar with your patient. You got to at first make that patient interaction. Without really developing that interaction completely, the patient's not going to be able to open up to whatever healthcare provider it is, and you really aren't going to dig into the details of what really separates their condition from other scleroderma patients as well. And you kind of get to understand what's most important for them and what really you can do to help focus on that importance and move forward from there to make sure that you're treating them as an individual case. I know before I was touching upon a little bit that each case is different, but sort of today, after seeing a lot of the patients around the table, you really can see that some patients have it's definitely visible that they have the condition, and then the others you won't even really know. So kind of like each patient, just wanting to make sure that you really get their full story and how they want to move forward, and then what the best way you can help them is.
I think one of the most significant things that I learned was how important it is to individualize care between each person, especially with one of the stories, how she talked about how difficult it was for her to open medicine bottles. Like, I would never have thought of that, and just to be mindful of that when working with each client or each patient.
I think one of the best parts was being able to actually talk with a patient who's experiencing it, because I feel like you learn so much more talking from someone and hearing their life story and the everyday struggles than you would ever learn in a textbook. And I think what was nice about this event was having people from different professions at the table, because you really start to see how one body function can impact everything else, and how we all need to be in the picture. One of the things I learned was that I never even knew about the difficulties with the digestive system relating to scleroderma, and if somebody's not getting the nutrients that they need because they can't swallow or have trouble in one way or another, and that may be a dietetics area, but it'll affect their occupational functioning, which is our area, because if they're fatigued because they haven't gotten the nutrients, or not feeling well, or tired, it'll impact their other areas of life. So having us all be able to talk about things together really helped, I think, and see the big picture, the person, their whole life, not just little snippets. So it was really informative.
So I think the most important thing I learned was how important it is to have all of those different disciplines working together, because all of us have different ideas. We come from different perspectives, and just like our patients, we're multifaceted, and we need to bring all of our ideas together to help all of these multifaceted areas that these patients need help with. And I also took away just the importance of listening to the patient and listening to what their concerns are, rather than just spewing off our ideas from our profession. It's so important to really take into consideration what matters to them.
Each and every one of you sitting here tonight plays a vital role in the care and treatment of patients with this disease, or with any disease for that matter. By working as one, I know the best is yet to come for the education and medical advances in the treatment and eventually the cure for this rare and detrimental disease that we know to be scleroderma. Thank you.